everyone, I'm Dr. Sailaja Musunuri. I'm the Chief of Psychiatry and EVP of Integrative Medicine at Wood System of Care.
And I'm Haley Gould. I'm the Manager of Structured Day Programming at Beechwood Neuro Rehab.
Hi Haley, thank you for joining us today. Can you tell us a little bit about what you do at Beechwood Neuro Rehab?
Of course. So I came to Beechwood Neuro Rehab about 7 years ago at the start of our Inspire program, which is one of our Structured Day programs. And about 3 years ago, I moved up to be the manager of that program.
That's wonderful. Thank you, Haley. Can you tell me a little bit about the individuals that we serve at Beechwood Neuro Rehab?
Absolutely. So the individuals at Beechwood Neuro Rehab are all individuals who have sustained traumatic brain injuries. Our entire population is comprised of adults, so we see everybody 18 to often into their 70s or even more.
So they have some sort of cognitive impairment and sort of physical as well as...
Yes, so we see a variety of individuals, many with cognitive issues or cognitive disabilities. We have many with physical disabilities, so we're kind of treating the entire person after their brain injury.
So today we are discussing ageism and ableism in individuals with intellectual disabilities and autism, and that also includes acquired cognitive impairment secondary to traumatic brain injury. What are the misconceptions surrounding aging, and especially in individuals with intellectual disabilities, autism, and brain injury?
I think that one of the biggest misconceptions is viewing aging as kind of a one-size-fits-all scenario. So especially as you have people who have intellectual disabilities or other autism and other disabilities, is really that they all need their own personal plan to continue moving forward, and they don't all fit into one box.
Yeah. No one size fits all.
Yes.
We need to make it more person-centered and individualized.
Absolutely.
I totally agree. We see that all the time.
Yes.
And do you think these misconceptions interfere with the quality of the care and the supports they receive?
I do. I think that there's obviously some more complexity in the aging components of people with disabilities, and they often, those two things of, aging care and disability care, the intersection isn't often looked at. So we have conversations about people with disabilities on their own and conversations about people who are aging on their own, but don't really look at how those two things happen in parallel.
Gotcha. And do you think these individuals, when they are really receiving care, what are the kind of common attitudes and behaviors that we observed along the way?
Yeah, I think some of the things with these populations that really were sort of, because of advances in healthcare, seeing individuals with disabilities aging where they are now for almost the first time. So the care needs to be reevaluated. I think sometimes there is, if people are in the wrong level of support system, almost a frustration.
Yeah.
Unfortunately, toward working with some of these populations where you might not have people who are necessarily the most informed working in one of these two areas, who are trying to learn new skills while maintaining, hopefully, a higher level of support. But I think when you're working with people who aren't able to necessarily verbalize the care that they need or cognitively form those thoughts to share the care that they need, they almost get swept under the rug.
Yeah, that's so true that, we at Wood System of Care, we are spending a lot of resources in training, the providers, and also the residents, the fellows and the NPs to really care for these individuals. I think there is a total lack of, expertise in dealing with individuals with IDD and autism over at the community level. And what are some of the things as a society we need to do to make an impact and also combat this ageism and ableism in the IDD community. What are some of your thoughts on how do we change things?
Yeah, I think the first thing that pops into my head is making sure that these populations are included in conversations. I think that as healthcare professionals, we tend to really just project the things that we think that these populations are in need of without directly having them have an influence on what they actually need.
Yes.
I think also just finding ways to take the care and that they are receiving. You know, many of these folks are not aging simultaneously to a new diagnosis, so finding ways to take the things that are meaningful to them and the care that is meaningful to them to continue through their lives.
Yeah, that's so important. Their voice matters.
Yes.
Any final thoughts?
I just think that there's a lot of, space to continue to grow in this intersection at really looking at these two populations, and I am excited to see where things go from here.
Yeah. Thank you for joining.